respected Professor Ahsan Iqbal Sahab. I know he has been professor, and I know about his academic credentials. So it's a very right person to be on this occasion. So thank you very much for coming here. And of course, Professor Asad Nizami and respected vice chancellors. I think a unique aspect of this conference has been the pivot emphasis on the academics. And you can see two vice chancellors sitting in the audience today, Professor Ziaul Haq and Professor Muhammad Umar. So and then you have the Professor Rizwan Taj, our own Professor Rizwan Taj, who is the chairman of the Pakistan and Medical and Dental Council. So on an academic and on a scientific forum, you cannot expect to have such a galaxy of the academic and scientific persons. And I won't go into I just want to highlight that this shows the scientific level, the academic commitment which Professor Asad Nizami and his team have achieved, and presence of these people over here. And of course, there are luminaries, there are very distinguished professors from psychiatry, very senior colleagues. I cannot name everyone, but I can see them in the audience who are sitting here. So it is really a privilege to be chairman of a scientific committee of such a highly prestigious academic forum. And I must say, I think I've been the chairman of the scientific committee, but I must say, I have not been troubled much by the very hardworking team. They have sought my advice at times, but mostly they have worked and have done very well. So I must congratulate the team which has been working with Professor Asad Nizami. And I cannot take their names. I think they will come over here. They deserve a big applause because of their hard work. I think one thing I would like to say, and I was talking to Professor Wajid Akhundzada, who is the president-elect, and I was talking to him that one main thing should be from here is that the PPS should not be just limited its academic program from conference to conference. And I was glad to see that he has very high ambitions about which he will talk about it. So I think that is the one thing, and I would like the participants to give the feedback about the academic program. It was badly affected by the postponement we had. That was beyond our control, but I think we have tried to put as much as what we could do. So I think at this point, I would just like to, taking advantage of Ahsan Iqbal Sahib, I would like to raise 2 points, 2 things. One is that it's very unfortunate that Pakistan, in both provinces, KP, etc., they have a universal health coverage program, not covering all the diseases, but you would be surprised, sir, that mental health is specifically excluded from both Sehat Insaf card in KP, and I think the other mental health program over here, there is no funding, at least as far as I understand. I think that is the biggest glaring omission. And I can understand that there are severe restrictions of budgetary. I'm not asking you to cover all the mental health. If you can, that would be great. What I would request is to cover the severe mental illness. Severe mental illness, sir, constitutes the most severe mental disorders like schizophrenia, bipolar affective disorders that ruin the young persons. The median age of onset of schizophrenia is 22 years. So once a person with schizophrenia is afflicted, they have to live with psychotic symptoms, disability for the rest of their life. And you will be surprised, the whole prevalence of the severe mental illnesses is around 4%. So to give you an idea, I know that you are the federal minister and the health is now devolved. So I would just request you to do one thing at least, that to start a pilot program in the Capital Territory. The Capital Territory population is 2.4 million. And if you calculate 4%, that comes around 10,000. So providing free treatment for at least that, so that is the one thing which I would like you to consider. Of course, Asad has been asking you about the mental health policy. Those are very important, but I think this is the most disadvantaged segment of the population. If you can do that, that would be a very innovative and very poor friendly, very pro-poor policy, because these are the people who are the most disadvantaged and the most poor. The second thing which I would like to say, I was expecting Professor Shoaib Shafi, who is not here, but I can see the two vice chancellors. So the two vice chancellors is to start the academic clinical fellowships program. The academic clinical fellowships are a unique program which I'm supervising the academic clinical fellows in UK, and that programs actually helps the people to complete the MRC Psych or MRCP training, at the same time prepare for the PhD. They have dedicated at least 1 day a week for research. So the minimum I would expect the CPSP to have at least 20 academic clinical fellows, not in psychiatry only, but through a very competitive, through a selective process. And I think the vice chancellors of the medical universities can help that. So if we can start at least these two, these can be the game changers for producing what we need badly, clinician scientists. I'm a clinician scientist. I've been working all along, and thanks God have been successful to some extent, but I think we badly need properly trained clinician scientists. So as a result of this conference, if I can highlight these two issues and have some steps taken towards these, that would be I think the best outcome of this conference. Thank you very much.